www.healthcmi.com. Acupuncture continuing education online today. Acupuncture and herbs, Alzheimer's finding. This was published at healthcmi.com on April 24th, 2020. Let's take a look at the findings. Again, if you go to healthcmi.com and click on news, you can look for this article. Acupuncture benefits patients with Alzheimer's disease. Wuhan Hospital of Chinese Medicine, that's in Hebei, researchers conducted a clinical trial. They conclude that a combination of acupuncture and Bushen Hoshe Tang herbal formula produces significant clinical results for Alzheimer's disease patients. Patients receiving acupuncture plus herbs experienced improvements in cognitive function and quality of life scores, total effective rate of 84%. The drug control group had a 68% total effective rate. So they give you the complete breakdown if you go to the article, all the details, the acupuncture points, the drugs used to help the patients as well in the control group. Now keep in mind, we're talking about helping people. We're not talking necessarily about curing. So when you're looking at a total effective rate, in other words, 84% of the people improved. So they're going to have a few more good days here and there, a little more clarity here and there, longer durations of cognitive clarity and better functioning. And that's what we're looking for with Alzheimer's disease patients. Acupuncture and herbs may not be able to cure it, but we can definitely help stabilize the patient to some degree and give them a little brighter outcome in the medium and long term. So let's take a look at some of the points used. Patients in the control group, again, they had pharmacological intervention. Prescription medications included donepezil, 5 milligrams daily, and nimodipine, 30 milligrams. But patients allocated to the acupuncture group received treatment at the following points. So you have your drug group and your acupuncture group. So Neguan PC6, Renjung GV26, yes, governing vessel 26. Bai Hui, GV20, Sanyan Jiao, spleen 6, Dazoi, GV14, and Shenmin, heart 7. Also, if people had kidney deficiency, they had bladder 23, Shenshu, kidney 3, Taishi, and GB34, Yanling Chuan added. In addition, they were given an herbal formula. Now, that herbal formula was Huang Qi. Now that's going to make a lot of people feel better. The astragalus, the Huang Qi, is going to give them a lot of energy, a boost. Some Shudi Huang, Dan Shen, Go Ji Zi, Du Zheng, He Shou Wu, Shi Chang Pu. That's going to open up the mind a bit right there. Chuan Sheng, Bai Zhu, Yuan Zhi, and San Qi. So that was that point. And there's some added details. For example, if people had constipation, they got Homa Ren 15 grams. If they had nighttime restlessness, they would have Swanzhao Ren 30 grams, etc. Urinary frequency, they could control that with adding a little Sang Pao Shao, 15 grams. Acupuncture and herbs, very good for that. And then they give you in the article all the parameters used to get the job done. So the activities of daily living score, the mini mental state exam, the SF-36 form, etc., used to measure the results. And they did a pretty good study here and found that, yes, you definitely get a bump when you add that acupuncture and herbs in there. We need to temper expectations. Alzheimer's disease is a terrible disease. So giving people a few more hours here or there of clarity each day or slowing the progression, these are the types of goals we're looking for. And acupuncture plus herbs does help to some degree, so it's definitely a worthy endeavor for these people to give them a little extra clarity. And this can bring a lot of comfort to the individual and families and friends who are involved, because you're making some modest improvements, and people have good days and bad days also, and we can try to make more good days than bad days. Again, I'm trying to present this that even though we have a good total effective rate, it's not a cure rate. So 84% total effective rate is not an 84% cure rate. That's a very different number. Boy, would we like to have that with Alzheimer's disease. I will add that scalp acupuncture is indicated for something like this. They did Bai Hui, which is very good, which is on the scalp. But again, I would like to see something like Sishen Sung added to that as well, or other types of scalp acupuncture. A little more of that, plus long needle retention time for that. And again, it's relatively painless. People don't notice when the needles are in and retained, but it can do a lot for the patient. Also, notably, they used Dazoi here, GV14. So that's also very interesting that they did that. And there's a nice photo representation of Dazoi. If you go to healthcmi.com, click on news, you can see a nice graphic of that acupuncture point. So take a look at this very important and clinically significant results. Thank you for listening. I'm Adam White, licensed acupuncturist for www.healthcmi.com.